So first I'm going to start by saying the student nurse is recording me. Alright, so now she's going to scan the room. Okay. So first I will start by saying that when I enter the medication room, I'm going to make sure that there are no distractions. I'm not going to answer any phone calls. I'm going to close the door behind me and not engage in any conversations with my coworkers. Alright, so I'm going to go ahead and verify my order with my MAR. I have Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963, medical record number 4176352, medical record number 4176352, allergies to penicillin. Okay. So here I have morphine sulfate 5 milligrams, intramuscular every 4 hours as needed for pain. Intramuscular every 4 hours as needed for pain. Alright, so now that I've verified the order with the MAR, I'm going to perform hand hygiene. I am going to enter the medication room and get my vial. And I'm going to go ahead and verify my vial with my MAR. Here I have morphine sulfate, 10 milligrams. Expiration date is 12/20/2025. And I'm going to be administering morphine sulfate, 5 milligrams, intramuscular every 4 hours as needed for pain. I'm going to go ahead and show my vial that expiration date is good. And it is morphine sulfate. Okay. So because I have 5 milligrams here, I know that I will be drawing up 0.5 mLs. But before I do that, I am going to grab my alcohol wipe. I'm going to clean my vial. Now to draw up my medication, I'm going to be using a 3 milliliter syringe and a blunt plastic cannula. Alright, so with my 3 milliliter syringe and my blunt plastic cannula, I'm going to go ahead and draw up 0.5 mLs of air. 0.5 mLs of air. Okay, I'm going to remove my alcohol wipe. Take this off. I'm going to push my ear in and draw up 0.5 mLs of morphine. Make sure I get my bubbles out. Okay. So now I'm just going to take that out. I'm going to scoop my cap back on and show that I have 0.5 mLs. Alright, so now I'm just going to, normally I would verify this with another nurse since it is a controlled substance. Alright, so now I'm going to go ahead and verify that this is the correct dose. Morphine sulfate, this is a 10 milligram vial, and I have 0.5 milligrams, and it is to be administered intramuscular every 4 hours as needed for pain. Okay. So now what I'm going to do is I'm going to go ahead and get it ready for injecting into my patient. Now I'm going to be using a 23 gauge 1-inch needle to inject it into my patient. So I'm going to go ahead and remove my blunt tip, put that in the sharps, and I'm just going to open up my and put that on. Okay. Alright. So now what I'm going to do is I am going to go ahead and make my label. I'm going to be sure to write the patient's name, medication, and dose. So this is for Jaguar Jones. Jaguar Jones. And it's morphine. Sulfate, 5 milligrams. Okay, so now I'm just going to place that to the side. I'm going to take my label. Alright, I'm going to put this on my syringe, and I'm going to verify my label with my MAR. So Jaguar Jones, morphine sulfate, 5 milligrams intramuscular every 4 hours as needed for pain. Alright, so now I'm going to, with my vial, my syringe with my label and the medication, and my MAR, I'm going to enter the patient's room. So now I would perform hand hygiene. I would put on, I would lower the bed. I would raise the bed. I would lower the side rail. I'm sorry. And I would also verify my patient with my MAR. Yes. Okay. Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963, medical record number 417-6352, medical record number 417-6352, allergies to penicillin, and here I have morphine sulfate, 5 milligrams from my 10 milligram vial. Morphine sulfate, 5 milligrams intramuscular every 4 hours as needed for pain. So before I administer my medication, what I would do is check the patient's respiratory rate. Alright. So since I've already raised my bed and lowered my side rail, I would now explain to the patient the procedure. I would also ask him if he has any other allergies. So I would say, "Hi, Mr. Jones, do you have any other allergies you would like to tell me about?" He would tell me yes or no. I would, I'm going to go ahead and put my gloves on. And I'm going to explain to the patient the procedure. Goodness, these gloves, they just don't like me. Alright. They don't. Come on, man. would just explain to Mr. Jones. I would tell him that, Mr. Jones, it appears to be the correct time for your medication because he has not received it yet. And then I would go ahead, get my alcohol wipe. I would wipe the skin. Place that right there. Alright, and just to be certain, I'm going to go ahead and verify the 7 rights one more time. So Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963. Medical record number 4176352, medical record number 4176352. Allergies to penicillin, and he is getting morphine sulfate 5 milligrams intramuscular every 4 hours as needed for pain. Here I have morphine sulfate 10 milligrams and here I have 5 milligrams because I have 0.5 mLs, and he has not received it yet. Alright, so I'm gonna go ahead and watch out for the tape. Take my cap off, place it in the sharps. Alright, I'm gonna spread the skin. I am going to push my needle in, and I'm gonna aspirate and for any blood return and inject the medication slowly. I'm going to take the needle out and put it directly in the sharps. And now I would take my gloves off. Towards the trash can. I would place the patient in a comfortable position. I would wait and see if he had any allergic reactions. I would also raise the side rail and raise the bed. I would wash my hands, or lower the bed, I'm sorry. I would wash my hands, and then I would document that he received his pain medication when I gave it to him, and how he tolerated the procedure.